Hi, I'm Barbiturates, and this is my autobiography. My generic names are amobarbital, butabarbital, pentabarbital, phenobarbital, sacobarbital, and mephobarbital. My brand names are imitosodium, butisol, nambutal, luminal, seconal, and mebaral. This is my chemical name. Next is drug classification. Under therapeutic classification, I am a anxiolytic, sedative, and hypnotic. Under pharmacologic classification, I am a CNS depressant. Next is my pregnancy category. I belong on the category D. There is positive evidence of human fetal risk based on adverse reaction data from investigational or marketing experience or studies in humans. But potential benefits may warrant use of the drug in pregnant women despite potential risks. Next is my mechanism of action. First, I bind to the GABA receptor, which is an inhibitory ligand-gated ion channel in the brain. The activation of the receptor opens and enables the flow of ion chlorides to flow across the cell membrane. From binding of the GABA receptor, it increases the duration of chloride opening. Then it increases the cellular flow of chloride, which leads to hyperpolarization of postsynaptic neurons. Afterwards, it lowers the neural excitability in the brain. I am absorbed almost completely after oral ingestion, and I will be distributed in the tissues and fluids. I will be metabolized by the liver and excreted through the urine.
I am indicated to treat insomnia, to produce sedation, pre-anesthetic sedation, and sedation during labor. I am contraindicated to patients with hypersensitivity reactions of my components during pregnancy and lactation, and to patients taking antidepressants, antihistamines, and MAO inhibitors. To patients having renal and hepatic impairment, dosage should be reduced. I am also contraindicated to patients having withdrawal symptoms like hypotension and CV collapse. I can cause side and adverse effects in your different body systems. In your CNS, I can cause drowsiness, lethargy, hangover, paradoxical excitement, somnolence, and syncope. In your cardiovascular system, I can cause bradycardia and hypotension. In your gastrointestinal system, I can cause nausea and vomiting. In your integumentary system, I can cause rash, pain, irritation, and urticaria. In your respiratory system, I can cause apnea and respiratory depression. And in the other body systems, I can cause angioedema, physical and psychological dependence. Here are the nursing responsibilities that you should consider before, during, and after administering me. Administer me orally on an empty stomach to enhance absorption. Warn patient of possible physical or psychological dependence with prolonged use. Tell patient to avoid alcohol while taking me. Elderly patients usually need lower doses. Monitor vital signs, observe IV injection site, and report skin rash or irritation. Discuss the importance of preparing environment for sleep or it may cause daytime drowsiness. Caution patient to avoid driving and other activities requiring alertness until response to medication is known. Assess sleep patterns. Advise patient to make position changes slowly to minimize orthostatic hypotension, and instruct patient to contact healthcare professional immediately if sore throat, fever, mouth sores, unusual bleeding or bruising, or petechiae occur.